This is part 2 of Does Acupuncture Work? And I posted a video just a little while ago about the philosophy of acupuncture and its effectiveness in treating injuries. And in that video, I shared a meta-analysis study of thousands of articles that they did literature review on the effectiveness of treating different pathologies. One of the ones that stuck out was carpal tunnel syndrome. I see that a lot. And in the study, it showed that the control, placebo, and sham procedure all had the same effectiveness at treating carpal tunnel disorder. Now, what is that? The control is actually using these long acupuncture needles here to supposedly get deep enough to the energy meridian that is responsible for carpal tunnel. The placebo was using these little ones, right? So not deep enough to get to the actual energy meridian. Now, the researcher and the patient didn't know which one they were getting. They worked on the energy meridian responsible for carpal tunnel, and it reduced pain by 50%. The sham procedure was done by these researchers as well, where they used the actual needle on the opposite energy meridian, as well as the placebo needle, and guess what? It worked the same. So we all know in medicine that the psychosomatic effect as well as placebo effect are very real. So one has to infer, does acupuncture work by placebo? And I believe so. I mean, I think you have to believe in it to actually get it to work. The difference in physical therapy is that we utilize something called dry needling. We use these same acupuncture needles to stimulate different deep muscles, right, that you can stick in here and actually work the tissue for tissue extensibility with the needle. And it works pretty well. So if you're doing it localized, then it's okay. Now, interestingly enough, we also use these needles, right, for electroacupuncture, right? So I actually stuck myself here with these little needles. And as you can see by this device, we're going to be contracting the muscles with these electroacupuncture needles, right? So a little pulse there. Now it's interesting because one, it does get blood flow to the tissue and it can help with tissue extensibility and reduction in pain. So that's dry needling. But you can also use these TENS pads, right? So you don't have to have this big fancy one I have in the office here. You can use a simple $50 model at home, but my muscles are contracting there. So this is the $50 model here. But in short, all I know is 20 years in physical therapy that acupuncture, dry needling, it will not improve your flexibility, range of motion, strength, stability, or neuromuscular control. You gotta work for that. Movement is medicine. Aloha.